So I had my breast implants about 12 years ago. I started feeling sick in about 2008, like stabbing pain in my chest, and just little things just kept going wrong in my body. And I remember feeling always like there was something not quite right about it. And I came across an article. There wasn't much information out at that time, and it just clicked for me, and I just knew that they needed to come out for me to heal. It took quite a few more years to decide that, because it's a big decision. And yeah, so I got them removed about a year ago, and yeah, feeling much better. On the internet, I started reading and came across some articles, and I just thought, wow, isn't that an amazing tool that we can use to, I guess, enhance our bodies or correct something without like a foreign substance. And it just really resonated with me, so I thought, I'm going to have a look into it. Yeah. So I met with Dr Sawhney, and he explained everything to me. He showed me before and afters, and I said, yep, I wanted to do it. So then we booked in the surgery, and I went to the hospital. I did my before preparation, went to the hospital. They got me prepared. Explained all the risks and etc. And then, yeah, went into the operating theatre, and I woke up and it was done. Yeah.
Taking the implants out left you fairly deflated?
Very deflated, as you know. Yeah.
I remember. So you've had your first fat transfer. As I said, we had to be conservative with how much we can do in each setting.
Yes.
How are you feeling after it?
Yeah, good. It's made a big difference.
Yep.
I'm really looking forward to the second one to fill them up.
Fill them up more.
But yeah, it's a big difference when you look at when I look at my pictures before and then look at myself now. It's really filled them out. So compared to what they were.
Good. Well, we better have a look at that next.
Yes.
And you're looking forward to your second one, which is in a couple of months. So we're almost doing it at bang on 3 months, which is when is the shortest period I wait between procedures.
Dr Sawhney guided me, and I just showed him obviously areas that I thought that the fat could come from, but then he kind of explained to me where would be best, and also there was like a staging process. So it's the first operation is taking fat out of a certain area, and then the second one was taking fat out of another area because it holds for longer. That's what he explained to me. I had about a week where I was in bed and just resting. I had a bit of pain in my chest and on my legs where the fat was removed. But I had a compression suit put on my leg, so it just made it easier to, I guess when I had to take it off to have a shower, it was more painful, so the suit was actually helping the pain. But yeah, after a week I was up and about and doing things like normal, obviously just a bit more restricted because of the pain. And now I'm 4 weeks down, and you can see I've got hardly any bruising and functioning like normal. So. It feels more natural with the implants. Always felt like I had obviously something in there, and now it just feels, obviously they're not complete yet, but there just feels like I don't have that weight on me. And yeah, it feels good. I don't think there's any comparison. There's just so many women that are now starting to struggle, and I think it's really coming to the surface now about issues like regarding breast implants and the risks of them. I would say fat transplant 100%. It's natural, it uses your body's tissue, and you get a more natural result as well.